Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Dr. Roger King is 1/4 of high school king Burns and Tallman. Kay, can you guess which one he is?
He's the first.
He's the second, actually.
Well, in my mind, he's the first.
Well, I don't think we've had Dr. High School in yet, but we have Dr. King in with us this morning. Good morning. Welcome.
Thank you. Good morning.
Good to have you on the program here today. And today's topic is colorectal cancer prevention. And Greg pointed out to me, Greg's our guy that comes from Mon General each and every week.
Greg Keeley,
He sits in with us and occasionally chimes in a word or two.
Occasionally.
Just so happens there's an Associated Press story on the front page of the Dominion Post today. Study says colonoscopy cuts death risk. I think I could have written that headline myself. That's what I've heard. Colonoscopies are very important. And tell us why, Dr. King.
Colonoscopies is a screening procedure to try to identify either high-risk patients that are more susceptible to colon cancer, or as a screening procedure to try to find cancers that are either very small or polyps, which are associated with cancers that can be detected and removed before they become malignant.
I like to think that we've come a long way in medicine. Of course, we've all been around a long time, but are the number of cases of colon cancer being diagnosed going up, or has it gone down?
Actually, the incidence of colon cancer stays about the same. It all depends on the type and when it's detected. But if you find cancers in polyps, then the incidence is going to go down.
What I understand, the information that I have here, 1,638,000 new cancer cases are expected to be diagnosed in the United States this year alone. That is a high number, it seems to me. 577,000 of us are expected to die from cancer this year. Is that just colon cancer?
That's total cancers.
Total cancers. Man, we've got, I guess we've come a long way in diagnosing cancer, but I'm not sure that we've been able to get the numbers of people developing cancer down. Is that going up as well?
No, the incident in West Virginia, there's going to be about 1,100 new colorectal cancers this year, and 400 and some are going to die. So that's still a death rate around 40%.
And I'm sorry, go ahead.
Go ahead.
I was going to say, like all cancers, early detection is what it's all about.
That's exactly right. But the early detection for colorectal cancer, there's several ways that you can do it. You can have an X-ray called a baryominima. That's going to miss small lesions or small polyps. Direct visualization of the colon called a colonoscopy, you're going to find the small polyps that can be removed, or even small cancers that can be treated surgically in the future.
Is there a magic age to have a colonoscopy, or do we wait until we start seeing something abnormal?
90% of all colon cancers are diagnosed over 50. People younger than 50 get colon cancers. If there's any change in bowel habits or bleeding from the bowel, it needs to be examined.
But it's automatic. If we go to a doctor regularly and they see that we're 50, 52, 55, is this going to be something they're going to suggest to us, or do we need to say, I think it's time for me to do this?
I think most conscientious physicians are going to recommend a colonoscopy over the age of 50, but if it's not brought up in any discussions, then I think the patients need to be informed enough that they can ask for one.
So if early detection is key, are there screenings to help detect colorectal cancer?
Screening, the best way is an endoscopy, a colonoscopy. Stools can be tested for occult blood that you cannot see but can be picked up chemically. That's one indication to do a colonoscopy if you have blood in the stool. There are some subsets of patients like inflammatory bowel disease, such as ulcerative colitis. They have a higher risk of cancer as the disease progresses. So inflammatory bowel disease needs a screening colonoscopy at regular intervals. There are some hereditary forms of patients who have a family history of polyps or a personal history of colon cancer. They probably ought to be screened at an earlier age.
So I'm wondering if anything at the health fair this weekend would help us. So if we have a family history, you could probably pick up some information, I'm sure.
Correct.
But those types of procedures that you talk about obviously need to be done at Mon General in a hospital setting.
Colonoscopies are done as an outpatient at the hospital as a general rule. Sigmoidoscopies, which evaluate the lower colon and only gets up to maybe 18 or 20 inches, those are procedures that can be done in the office.
Explain what is a colonoscopy. Most of us know by now. We've had one or two. But for those that have not, explain what is a colonoscopy.
Colonoscopy, there's two parts to it. Number one is you've got to be on a liquid diet for 24 to 48 hours. You do have to take laxatives, which require at least a half a gallon of fluid to clean the colon out. If that's not done, small polyps can be missed, and you only want to go through that exam one time, so it's important to be cleaned out.
Yeah.
The scope that we use is about 5 to 6 feet long. It has to be threaded up into the bowel. In order for the bowel to be visualized, it has to be blown up with air. That's what causes cramps and discomfort. And to make that tolerable, patients are sedated in a variety of ways so that it takes away that sensation of cramps.
So scope of 5 to 6 feet long. Obviously, it bends. I hope it bends.
It's a flexible scope, yes.
All right, because that's going to be important because your colon intestines are, I mean, they're long. They're all wound up, but they're long. And so the scope is able to navigate those sharp curves in there.
Not everybody's a suitable candidate for a colonoscopy. It's an invasive procedure. There's always a slight risk to it.
Well, who's not eligible, or who wouldn't be able to get a colonoscopy?
People that have had previous examinations that have been unsuccessful for adhesions or severe diverticulosis. Sometimes those people are very hard to examine.
Can there be kinks in the bowel of any type?
There can be kinks in the bowel. About the risk of a colonoscopy, there's about a 1 to 1,000 risk of having a perforation. So it's not an innocuous procedure, so it's got to be done very carefully.
Yeah, and let's just point out that we don't want to scare people away with this. We're just trying to give you the upfront information of how this all works, because you will lay down and then you'll wake up and it's all over. It goes very quickly and you're really not aware of pain.
That's correct.
Okay, I turned 50 last year. Does that mean I should just go ahead and get one just for the heck of it?
Sure.
Yeah, I think sounds
Kathy
like fun.
Trick did.
The way Kay's described it just sounds like a blast.
Yes, absolutely.
All right, we're going to take a break. You're listening to Health Talk, which is brought to you by Mon General Hospital on WAJR.
The doctors, the latest news and procedures. Your local health connection is Mon General's Health Talk. If you'd like to be on the show, call 304-296-0041.
Dr. Roger King is our guest today, and of course, he's with Mon General Hospital, but also High School King Burns and Tallman, and we're talking about colorectal cancer. Let's get into that prevention. There's a lot of advertisements right now for colon cleansing products and supplements, including probiotics, I guess, that are supposed to help with the digestion of food in your intestines and colon. So are these things effective, and do they prevent colorectal cancer in any way?
We cannot prevent colorectal cancer. We know that cultures and people that have a lot of fiber in their diet are going to have a low incidence of colon cancer. Colon cancer is associated with an increased fats in the diet, such as red meat. Alcohol, smoking obviously is a contributory factor. Cultures that have a high fiber in their diet, say Africans, they have almost no colon cancer. They have a lot of other problems, but they don't have diverticulitis, appendicitis, diverticulitis, or colon cancer. So at least fiber seems to be the most single thing that people can do to reduce the risk of colon cancer.
We eat a lot of processed foods.
We do.
But the probiotic supplement, for instance.
That's really to maintain a bacterial level that's normal in the colon.
The bacteria is good in this case.
That's correct.
That helps digest the food.
That's correct.
All right. What about these colon cleansers that I see sold on TV? I don't know if they're sold over the counter. I guess they must be if they're sold on TV.
I've never heard any personal
Stories of whether they work or not?
Whether they work or not. It seems to boil down to fiber.
Okay, so more fiber in our diet, less processed food, less meat.
Fat.
Less fat.
Less smoking.
All right, and less drinking. That's pretty much the prescription for life, isn't it, Kate?
It is. You know, when we do these shows, lifestyle really does have so much to do with our health. The medical factor risks, you mentioned family history. Can you point out some other medical risks?
Type 2 diabetics are a little bit of higher risk for colon cancer, and we screen those a little quicker than the normal population. And previously noted that if you have Crohn's disease or ulcerative colitis, those people need to be screened a little bit more regularly. If you have a history of polyps, if we find polyps, we usually will rescope people after around 2 years after they're found until they're clear.
Male or female or race have anything to do with it?
Doesn't really matter.
Doesn't matter.
No.
Do we know why type 2 diabetics are more susceptible?
I do not know.
Wow. So even if they have it under control?
They're still at a higher risk for colon cancer.
Our number is 304-296-0041 if you have any questions or comments. So early stage doesn't typically have any symptoms, but as it progresses, what are some of those signs?
Bleeding is usually the most common sign, or blood in the stool. Now, a lot of people with rectal bleeding, that's another benign condition that can occur from hemorrhoids or so, but you can't say that that's the source unless you take a look.
I remember one time when I was a kid, urinating blood, I think it was a kidney infection, but that doesn't have anything to do with it. That's not a stool issue.
No.
Right there. So blood in the stool, change in bowel habits.
That's certainly one symptom.
Cramping and anemia. Anemia is low iron.
Low hemoglobin.
And
that usually, if it's from a colon cancer, it's usually from the loss of blood from the tumor.
And again, 91% of cases are diagnosed over the age of 50. So if you're like me and you've reached 50, I guess there's something to look forward to here in the next year or two. Yay.
And again, we point these points out to you because how important it is to know your body and early detection. And if you have not had a colonoscopy for some reason or another, maybe talk to your doctor about that. And it could save your life. It really could. So
if you're scoping and you find a polyp, or I mean, is it visual? You have a camera at the end of the scope? They're flexible scopes. They're all hooked to a video monitor that we work off of a monitor. There are a variety of polyps. Some polyps are very flat and smooth, and those are called sessile polyps. Those are more difficult to get out. Adenomatous polyps, sometimes they're on a stalk. Those are relatively easy to take out.
And they can do it during the colonoscopy,
They can be done during the colonoscopy. Some sessile polyps or flat polyps, you can't get underneath to cut them out. That may require a bowel resection sometime later.
Can you zap them with a laser, any of these polyps?
We don't use a laser. We use an instrument called an argon beam that can take care of real small polyps.
Argon beam. Well, those scopes have everything.
They have everything.
Even have 4 doors and stereos in some of them. So we invite your phone calls at 304-296-0041. We'll take our final break. If you have any questions, pick up the phone and give us a call. We will be right back after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Making colonoscopies fun here on Health Talk, brought to you by Mon General Hospital with Dr. Roger King. He's a surgeon on staff at Mon General and with High School King, Burns, and Tallman.
Well, since we're focusing in on these colonoscopies, we would all agree, those that have had one, the prep and preparing for it is absolutely the worst part of it, Dr. King. Would you not agree?
Yes, but it's the essential part of it.
It is very
Yes.
much so.
What do you mean? You have to stay close to a bathroom?
That, yes, indeed.
Pretty close.
Yeah.
Yeah.
And the prep for it, and yes.
So don't go shopping at a big box store.
Absolutely
and
not.
Find yourself by the greeting cards.
It's best
Whoa.
to stick very close to home and getting prepared to have your colonoscopy. But I'll tell you, afterwards you feel pretty good, because you have all that stuff.
Because
out
you've
of your
lost 5
system.
pounds, right?
That too. That's right.
Yeah.
I do want to talk about new cancer cases, and the number just seems startling to me: 1,638,910. And I know you started off the show with this, but do we have any answers of why this continues to climb and why we still see these type of numbers? We're a society of so much science, and why we can't find number one, a cure, but a stop to these cancer cases.
If you look at the incidence of cancer, lung cancer has exceeded both male and female, and we still smoke. The society is still a smoking society, and that's a single reason that lung cancer has exceeded both male and female as the most common cancer. Breast is second in the female, prostate is second in the male, and colon rectal cancer is both third in both male and female.
Now, the lung cancer, we understand. You smoke, you perhaps will get lung cancer. The breast cancer for women, sometimes that's hereditary. So not much that we do to ourselves that could cause that, right?
Correct.
Okay.
But there's still a lot about our diet. I mean, that probably contributes to it. You mentioned in Africa, they don't have this. I mean, they're mostly high-fiber diet, but I'm thinking, how much meat do we eat with every meal? I mean, most of us probably have some kind of protein with every meal. They talk about how important the protein is.
But you can go to non-red meat substitutes such as fish and fruits and vegetables, and it does make a difference.
So if we all did that, if we all changed our lifestyle pretty much, then the numbers would start going down.
You would think so.
And when we look at the number of 577,190 Americans are expected to die, do we know enough, or can we know enough to stop all the deaths? I mean, I know that as a doctor, you do everything that you can with the resources that you have, but do we need more science involved in it?
I think there's future. It's going to be a genetic solution to a lot of these cancers, and people have started trying to do DNA on stool samples to detect whether or not they're at a higher risk for colon cancer. That's still in the investigative stages. But if you're for colon and rectal cancer, if you find a polyp that's malignant or pre-malignant, you take it out. You're curing that cancer. 90% of stage one cancers, whether they be in a polyp or just a small tumor in the colon, 90% of those are going to be alive at 5 years.
Tomorrow, we're going to pick up all this equipment, and we're going to take it to the Morgantown Mall for the Health Fair, Kay. We're broadcasting live. We're going to be in person in front of people.
Yeah, we're going to be down around the food court. Very appropriate.
yeah.
Yes, that's where
High
we'll
fiber
be located.
tomorrow.
Yeah, hamburgers.
No hamburgers, all high fiber.
Yeah, it's red meat. We could do chicken, Chick-fil-A, right? Yeah. All right, we could do something like that.
A lot of options.
Greg Keeley, tell us the hours of the health fair if you know them.
Yeah, top of the morning to you, Jim and Kay.
Good morning.
Dr. King, we appreciate your presence on the program this morning. It's 7 to 7 tomorrow, and thank you for being on the program tomorrow or bringing your program out there. It always helps us to promote what it is that we're doing. Lots of free screenings. It's 7 to 3 on Saturday. So come on out and see what this is all about. We'll be also promoting our new website, which we'll be unveiling soon, mongeneral.com. It's going to be focusing on our tremendous physicians and fine staff that we have, and also provide a lot of great information for you, the consumer.
And at mongeneral.com, you can see videos of this program archived, and this one will be on there soon. Visit that website, mongeneral.com. For Kay Murray and Dr. King, I'm Jim Stallings. News is next.